blood has healing components such as these platelets, as well as growth factors and nutrients, as well as plasma. These can be concentrated down and injected into damaged knees, the rotator cuff and shoulder, the elbows such as tennis elbow, the hands and the wrists, even the spine, cervical, thoracic, and lumbar, as well as pelvis and hips, and the TMJ. At Gecko, we also use honey matrix, which can make PRP work better. In some cases, we consider adipose stem cells because fat has such a high population of stem cells. Using the stem cells from bone marrow is also very powerful along with PRP. Gecko is one of the first clinics to actually offer bone marrow and adipose combined together in the same treatment. At Gecko Joint and Spine, we can both diagnose your problem as well as guide our injections to precisely the right area using high-definition ultrasound.
The FRP really feels like there's this healing jello on the inside of your body, and it's like something out of science fiction. I mean, if you look in like a lot of science fiction movies, like in the future, you're supposed to be able to take some jello and stick it in your body and it regenerates you, but it's not science fiction, it's actually real. So I had my meniscus removed in 2006 after it was an injury that originated with something I did with yoga 19 years previous. And I've been without a meniscus, and I developed this kind of arthritic condition all over the left, what would you call this, the left part of my kneecap.
Medial knee.
And that pretty much healed almost immediately. The entire pain was gone with one treatment, and probably, I don't know, within minutes. And right now what I have, I think, right in the center of the knee, there's still a little bit of weakness, so I'm looking to get today a second treatment. I had a pain from banging my shin in Israel against a bus when I was trying to get on a bus. Literally 30 years ago, the Prolo shot went in, 100% success, 100% healing instantaneously. Haven't had any problem. On the other hand, my left ankle, the tendonitis in my left ankle,
Achilles tendon.
Yeah, that took longer, and that was the most interesting one, because after 24 hours I was comparing it to the instantaneous healing in the knee, and I was like, oh no, maybe this isn't going to work. But little by little, hour by hour, after 3 days, pain was entirely 100% gone, and Dr. John just adjusted the ankle, which now makes it feel completely normal. My lower back feels great. I mean, we had a whole bunch of injections in the lower back that now I'm looking to just maybe, do some more things that are going to help more with posture. Mm-hmm. And my thumb. So here there were 2 arthritic points, and we treated the worst one, which was, what would you say, this is at the top of my wrist, basically? Yeah. Uh-huh. That's 100% healed, and the other point, which was not treated, is still hurting like crazy, and we're going to work on that today. Now, regarding the pulsed electromagnetic, that is very effective and very helpful, and was especially helpful with the ankle. I think it accelerated the healing in the ankle.
For more information on PRP and other exciting regenerative therapies, log on to geckojointandspine.com, or you can call our office. You can also reach us by email at askdrgecko@gmail.com. Remember, if regeneration is possible, consider it to be within your reach.